All right, we are live. Hi, everyone, and welcome. I am Gulf States Newsroom Community Engagement Producer Nellie Beckett. We are a public radio collaborative across Alabama, Mississippi, and Louisiana. Thank you so much for joining us today for SANES and Survivors in the South, a listening session unpacking our health reporter Drew Hawkins's year-long investigation in partnership with Type Investigations, a nonprofit newsroom dedicated to transforming independent investigative journalism. We'd like to thank Drew's sources as well from across the world of sexual violence and healthcare response. We'll listen to some reporting, hear from our sources, and we're going to have a Q&A. Please, if you have questions, put them in the chat, and if we can't respond to them now, we'll follow up via email. We'd like to thank our partners for making this reporting possible: the Corporation for Public Broadcasting, National Public Radio, W.K. Kellogg Foundation, the Commonwealth Fund, and Type Investigations. We'd also like to thank our station partners, WBHM, Mississippi Public Broadcasting, and WWNO, where you can hear and read our work. You can also hear us on the Gulf States Gumbo, wherever you get your podcasts. Today we'll hear from Shalotta Sharp, Julie Ford, and Morgan Lamandre. Shalotta Sharp, RN, SANE A, SANE P, is Special Projects Coordinator, State SANE Coordinator for the Mississippi Coalition Against Sexual Assault. She's also a telesane for the University of Arkansas, Medical Science Systems, and a consultant for the Department of Defense. She resides in York, Alabama. Julie Ford is a survivor of sexual assault and PhD student who studies the experiences of survivors of violence. She also volunteers with the local organization Crime Survivors NOLA, who provide a free guide to help people navigate complex systems after violent crime. She resides in New Orleans. And Morgan Lamandre, Esquire, is the CEO of Sexual Trauma Awareness and Response, or STAR, a nonprofit sexual assault center with 3 locations in Louisiana. Morgan has been involved with the organization since 2007, beginning as a volunteer hospital advocate and becoming a full-time staff member in 2013. She resides in Baton Rouge. And Drew, I'll let you introduce yourself.
Thank you, Nellie. Hey guys, if you don't know me, I've talked to a lot of people in this room, but if you I haven't, my name is Drew Hawkins. I cover public health in the Gulf States Newsroom. And should I introduce more, Nellie, or should we go into the slide deck, or I can talk more about myself, I suppose.
I'll go ahead and share that deck. Thanks, Drew.
Cool. I was joking before we admitted the waiting room that it's interesting after spending more than a year talking to so many people and asking so many personal questions. Now I'm nervous to talk in front of this group here. But I mean, I'm really happy that you guys are here and I really appreciate it. So, yeah, just a quick content warning. Obviously the subject matter of this discussion is pretty heavy, but just wanted to be clear about that. And if we have some resources here, if anyone isn't aware of them, you can go to the next one, Nellie.
Mhm.
Right, and you can go to the shortage one. Great. So I wanted to kind of quickly put basically like 3 buckets to kind of, as best I can, encapsulate how this project has been. So starting with maybe the shortage, because I think from my perspective as a journalist, this is how this project started for me. I know for a lot of people in this room, this is your work, this is your life, you know this stuff intimately. But I had seen that, there was I know there's a shortage of nurses, but I had seen some reporting about the shortage of SANEs, and I was curious about how that might look regionally. I looked into the numbers. I had seen some reporting out of Alabama about a survivor having to drive themselves across to another county. And I was wondering how widespread that might be. So, took a look in these numbers, talked to a few people, and took this idea to my editor at the time. And she was really into it, but she knew that the scope was pretty large, and so we needed some help. So we reached out to Type Investigations. I have 2 of my editors here on this call who worked with me as this investigation really evolved and changed over time. And one of the first things I did is I met Shalotta Sharp, who's on this panel. And Shalotta is an incredible person, and she invited me to come to a SANE training, which would just so happen to be coming up in like a week or 2 after we spoke. And when I was there, I learned a lot. I learned a lot about what goes into being a SANE, what nurses are interested in doing this, what barriers also there are to becoming a SANE. The training can often be, unpaid, even if the organization may offer free training, travel, lodging, things like that. There's these barriers about like, compassion fatigue, burnout, and honestly, it just takes a certain type of person to be able to do this kind of work. And I think so when I came across this barrier, and I think that brings me to my next slide, Nellie, is then I got more into what are the impacts here. One of the things I learned at that training, which kind of changed a little bit of what I was doing this investigation, was that it seemed to be pretty common, or it seemed to be something that happens relatively often, where a patient presents to a hospital emergency department after an assault. That hospital does not have a forensic nurse or a SANE, and they are then either transferred or to another facility. And I realized that that would obviously be a pretty big barrier, or could be a big barrier for people. So, not being able to get that care, the importance of that care as well, the trauma-informed nature of it, and as well as the critical role that it can play in prosecution, the critical role that SANEs themselves can play in prosecution. So, this impact could be not just bad for their medical care, their long-term well-being for survivors, but also potentially in legal outcomes. Um, this slide here, this is a piece of art that was done for the piece. That this is the travel area for the two full-time Jefferson Parish nurses. Um, they've had to absorb other parishes, so their travel area is unusually large. But it kind of just illustrates to me that there's this problem, and then there have been attempts and solutions to try to come up with it. So, there have been attempts to come up with solutions to address it. One of them being travel SANEs, where the SANE will go to the hospital. Another one being telesane. Shalotta, I believe you do telesane work as well. And to me, these solutions also help illustrate the underlying problem there. And also, I think just if you just look at this image, that's got to be exhausting. And so also, the impact here is also on the nurses themselves, the difficult nature of the work, what it takes, what the toll it can take on you, and all of that. I think was just something I really wanted to get at with the impacts of it. You can go to the next one, Nellie, and I'm gonna. So the larger piece being maybe the systemic issues or attempts to address it. Traveling SANEs, telesane, these are attempts to address it. But one of the things, just from a reporter perspective, it made it really difficult to and nail down specific numbers on some of the impacts. Like, because there's not a system that tracks when a patient goes to one hospital, and if they're transferred to another, and that other hospital receives them. There's not that handoff. So that information of how many people present after an assault but don't go to that second facility to get the exam it's not collected. So, as a reporter, that was a difficult thing to overcome. But just as a thing in the system, it's a large problem, right? This image here comes from a conversation with a nurse, a SANE at UMC, where she talked about how the extent of some of their tracking systems is she will get a call from another hospital, get some basic information about a patient. They're saying, hey, we've got somebody here. We're going to tell them to come to you. She'll write down their name, their date of birth on a sticky note, put that on her computer. And if that person doesn't come, eventually she's got to throw that note away. So that's something that just really stuck with me, and was why we wanted to kind of pull it out as an illustration for the piece. Um, and I just thought it kind of, it just kind of really well captured how much information is actually lost in those sticky notes in the garbage can there. How much of a story or an experience or trauma is behind that. And so that, it was a large scope of a story. And it was a lot of challenges to try to wrestle it. But it couldn't have been possible without the incredible sources who were willing to talk with me, share their experience and their insight and expertise. And when the written story, apologies to my editors in the room, was I think maybe 4,000 words at first, and we kind of got that a little cleaner, and then I condensed that into a 14-minute radio story, and I have since condensed that into a social media reel that really, in broad strokes, I think kind of captures the story. So if you aren't familiar with it, that's fine, because we're going to play a reel now that kind of gets at some of the larger aspects of the reporting. Are you able to pull it up, Nellie?
Oh, I'm sorry. What's it on?
Yeah, I thought you were gonna.
Is it y'all aren't seeing it? I'm so
No,
sorry. I thought
sorry, no, we don't
it
see it
play.
on our end.
Okay. I'm gonna go ahead and stop share. Drew, are you able to pull it up on your end?
Yeah, I can do that. Let me share mine, share sound. Here we go. Okay, let's get this to play. Some of my Hearts of Hope people may recognize this hallway. Every handprint you see is from a survivor of sexual assault. They're pasted on the hallways at Hearts of Hope, a sexual assault resource center in Lafayette, Louisiana. It's one of the places I went to as I spent more than a year investigating the impacts of a shortage of a special group of nurses. They're called sexual assault nurse examiners, or SANEs. And what makes SANEs special is what's called trauma-informed care. They're trained to work specifically with sexual assault survivors, and they connect survivors to advocates who can sit with them during a forensic exam, what's commonly called a rape kit. Forensic exams are crucial pieces of evidence. They can make or break a sexual assault case, and SANEs can be certified as expert witnesses and testify in court. So they're really important. The problem is, there aren't enough of them. Alabama only has 44 certified SANEs for the entire state. Louisiana has 42. Mississippi has 6 for a population of almost 3 million. So what can happen is someone who's just been sexually assaulted, they might go to their local hospital looking for help. But if their hospital doesn't have a SANE, they may be told they need to go to another facility that does. And that can be across town, it can be across the state, or it can be across state lines. And sometimes survivors end up driving themselves. Shalotta Sharp is a certified SANE in Mississippi, and she talked about what this could mean.
So by turning this patient away, you've basically stopped all of these other processes that we could be doing for this patient. But the biggest part of it, we're looking at a patient and saying your trauma doesn't meet criteria for us to see you here.
Now, exactly how often patients have to travel to get this care isn't clear. None of these states track how often this happens, but it does happen. I talked to several nurses, advocates, and legal experts who told me that it happens. So if someone is assaulted and they go to a hospital that doesn't have a SANE, there's no way to know how many are told they need to go somewhere else. And that's not just bad for their well-being, it could also impact their legal outcomes. Here's Naomi Jones, a former prosecutor in New Orleans who worked on sexual assault cases.
Imagine like it being brutalized and then prodded in a medical facility, transported over state lines or across parish lines, how many different strangers you're going to have to interact with. When a lot of times after that kind of trauma, people just want to go home and sit in the dark by themselves.
SANEs were started by a group of nurses who wanted to improve the quality of care for patients and the quality of evidence collection for prosecution. But because there aren't enough of them, you end up with this situation that Shalotta Sharp calls a double-edged sword, where you've got these SANEs, these specially trained nurses who are there to help people. But if a survivor can't access them, if they're told they need to go somewhere else to get a forensic exam, it ends up jeopardizing not only their medical care, but also their chances at trial.
Drew, thanks so much for sharing that. So now we're going to transition into the panel discussion and Q&A. I'm going to turn it over to Drew and our panelists. Thank you so much for being here today, y'all.
Okay, great. You know, for a lot of people in this room, I feel like the information is not revelatory. You are very familiar with it. And I think that's where I'd maybe like to start with my panelists, with Morgan, Julie, and Shalotta. One of the things that has come up as I would talk to people, go to meetings and learn things is that like sexual assault response plans and content, the structures in place, these are things that people do not think about until they need them, right? So I feel like for you guys, people who are very intimately aware of this world, what I would ask is like what you would want more people, whether that's the public or maybe lawmakers or policymakers, what's something that you wish they would better understand about this issue, if they haven't even directly encountered or interacted with it. I guess maybe I'll start with Morgan since you unmuted. That makes it easy for me.
Of course. Yeah, so first, thank you for having me on your panel. And I do recognize some names, and hopefully it doesn't feel too much like preaching to the choir. But I think for me, and obviously I'm very familiar with Louisiana specific way of doing things around here, but a lot of people have this mistaken belief that if you show up to a hospital, getting a forensic medical exam should be very similar to any emergency doctor being able to do something like a gynecological exam. And that's just not the case. I think that it goes beyond just sort of doing the physical component of examining the survivor, but from start to finish. One, that trauma-informed lens, understanding this person is coming from this perspective that they're, one, not going to remember things in a sequential pattern that, like, if you're not in a traumatic incident, you're not going to be able to just easily say what happened from start to finish. You're going to remember things based on a sensory component. And then, what I've seen is that doctors who are not trained in this area then write narratives as if they are suspicious of a survivor. And it's just that they don't understand when you've been in a traumatic, situation, you are not going to remember things just line by line, but as time goes on, you may remember stuff. So if somebody says, I don't know if there was penetration or all, you should not treat that exam as if you were not going to examine that survivor as if there is no penetration. You need to be able to, assess and go with that trauma-informed approach, that just because somebody doesn't remember in that moment doesn't mean it didn't happen. And I think that for another aspect of how things tend to be is that, just the head to toe exam. Too often people believe of the, Law and Order, special victims unit, that getting DNA, like, so getting an exam and, oh, let me test my kit. And if there's DNA, that automatically means a sexual assault occurred. That is typically used for identification purposes. What's really important is that comprehensive head to toe exam. If something can be consistent with a survivor's narrative of an assault, we can't say without a doubt that these exams can prove that a sexual assault occurred. But what they do is they allow for evidence to say that this is consistent with a survivor's narrative of what happened. And that's really important, because all too often I think survivors also get these exams thinking they're going to be validated by some sort of proof in DNA. But as we know, most of the time it's somebody known to the survivor. So they're going to say, yes, you're going to find my DNA because it was, quote, consensual. But that head to toe exam, the documentation that SANES are able to do to show every thumb mark bruise that's on your wrist, that, I'm sorry, but like, so you're saying you didn't hold the person down, like, that matters. And so, no, not just any emergency doctor who did go to medical school can do this. And I think there's a quote I've seen on, like, gifts for nurses, like, thank a nurse, they help keep doctors from killing you. And that's absolutely positively true in every sense, but in particular in the forensic nursing world, nurses are the reason that survivors, I think, can really get to a place where, whether it's whatever justice is for them, justice can come in many forms. By going through an exam with a sexual assault nurse examiner, they are not left with that same invalidation that we see survivors who do not have that same experience. So again, I could talk about this forever. I don't even know what your original question was, but I have so much I could say about this. And with my legal background, I think that really highlighting that, no, not just anybody who is a trained medical provider can do this, and also understanding what these forensic medical exams, what they can prove and not prove. So I'll let somebody else talk now.
Thank you, Morgan. Shalotta, Julie, either whoever wants to jump in.
Yeah, I can talk a little bit about from a different perspective as a survivor. I'm really familiar with all this stuff now, but when my sexual assault happened, I had no idea. Like, I didn't know about advocacy groups. I didn't know what a sexual assault kit was. I had just been relatively luckily kind of sheltered in my life and hadn't encountered that before. And mine was one of those quite rare cases where it was a stranger, which is not common. And there were a lot of injuries, physical injuries. So I was brought by ambulance to the hospital. And I think people underestimate the shock that you're in that situation, and also the practical things that are going through someone's head. Like, I was thinking about, like, I want to go to a hospital that I know my insurance covers on the West Bank where I lived at the time. And I remember asking in the ambulance, where are we going? And I want to go here. And they were like, you have to go to UMC for a forensic medical exam. And I'm like, I don't even know what that is, but they said something like, that is what you're going to need to, like, prosecute, or to have the police investigate the case. So I, remember being really confused and just disoriented, and, didn't want to go to that hospital, which was further away. And I knew probably would be really expensive for me as somebody who had insurance, but my insurance, that hospital was out of network for me, UMC. And so as a result, I was able to get a forensic medical exam. And luckily, I got connected with an advocate from STAR who showed up at the hospital, who was wonderful and, provided me with all these resources in the aftermath. But my regular medical care, like, I had a traumatic dislocation of my hip, and it took way longer to get that dealt with over there because there were more pressing medical issues, like people who had life-threatening things that needed to be addressed. So there was a delay in care that was pretty substantial that, I think probably resulted in some, like, more negative outcomes for my hip. And so I always kind of thought, like, I understood why I had to go there. Like, I don't regret that happened because it was really important to prosecute the case, but I feel like I had to give something up for the reason that I couldn't go to a hospital that could kind of take care of those other things in a timely manner. So I just think that, like, if it was a situation where I had a choice between, like, fixing my body and my injuries or prosecuting the case, like, I don't know what decision I would have made because I'm still having medical issues from that delay in care. And survivors shouldn't have to make those choices. They shouldn't have to worry about how much something's going to cost in this situation, or not be able to go to a facility that they want to go to that's convenient for them, that they're comfortable with. They should be able to see doctors that they know and trust in their, where they live. So, I mean, even the aftercare parts for mine, I was never able to follow up with any of those doctors and had to find new doctors for subsequent surgeries, which was really hard. And that was all because I had to go there for the forensic medical exam. So I think thinking about all those practical issues that survivors face as barriers, because you're already going through something so traumatic, you're in shock, you're, not really sure what's going on. Regular people are not really familiar with this stuff. I mean, after all these years, I am, but at the time it was very confusing. So we just need to remove more of those barriers for people in general.
Thank you, Julie. Thank you for sharing that.
Is it my turn?
It is.
All right. And really, that worked out really well to get to hear from Morgan and Julie first, and hear their experiences and their take, and what it looks like in their community. First of all, to piggyback on some of the things that Julie said, first and foremost, she made a really good point that she was brought in for her case by EMS. This is another area of healthcare that we need to do some education with. It is the exception, not the rule, of Julie's case, and having to utilize EMS and a pre-hospital provider. But boy, Julie, wouldn't that have been great if your EMS team had been trauma informed and educated on the forensic patient, on something other than, hey, this is the hospital we have to take you to, and having a more trauma-informed approach. So that is something for those of us that educate on this, and as my role as the state coordinator and special projects coordinator, is that we try to reach out into those communities. And also, with you having some significant physical injuries, that is the priority, is the medical care and the health, the physical health and well-being of that patient, in addition to the psychological component of the trauma that they experienced. And Morgan did such a great job telling us about how the brain processes trauma. That is individualized. And the way that I teach medical providers is, especially, and this works great with ER nurses, is I'll tell my ER students, and really it works with any area of hospital, but it resonates with ER. If you've seen two patients that come in from car accidents, and the car accidents could be very similar, you could have two completely psychological presentations, but they're still very traumatic for that patient. And so that's something that we teach nurses, is you've already seen trauma response and how different that looks from patient to patient. And that is applicable to sexual assault patients as well. Morgan made a really good point of, we want that, yes, any registered nurse and higher licensed provider can collect those specimens that are in the kit. And I just finished a Zoom where I had to talk about a kit. So here is the Mississippi kit. And if I were to pull these envelopes out and start showing them to everybody, it's Q-tips and it's pieces of paper and it's instructions. And so obviously, as any registered nurse, we can read, we can operate a Q-tip. Probably everybody on this panel today and attending has had either a COVID swab or a flu swab or a strep swab, meaning, they've swabbed some kind of mucous membrane to see if you have an infection. And that's what the kit is. It's lots of Q-tips. And in the Mississippi kit specifically, we have instructions. We just redid the kit a couple of years ago, and we put detailed instructions on every single envelope so that you know how to collect that specimen. And that's the term I used. We're collecting specimens from a patient's body to see if it has DNA. And we don't, as nurses and providers, we're not seeing if it has DNA, but we're sending that to the crime lab for them to do their job. So we're one cog in this wheel. We're one piece of this puzzle, if you will. And it's important that we collaborate with our community partners. So yes, any registered nurse and higher can collect that, but we definitely want and prefer to have that same trained provider, that sexual assault nurse examiner, the one that's been educated on recognizing trauma, on understanding how the brain processes a traumatic event, understanding that the memories may not all be there, but we can collect the specimens based on what we know can happen in this horrible criminal act. We occasionally will have patients that maybe there was a substance that was given to them for the perpetrator to facilitate this criminal act. Those patients are not going to have a memory. So we educate nurses that you collect based on what may have happened, what we know can happen, and collect specimens from that part of the body based on that. And that's part of that training as well. Drew, I do want to kind of wrap up with one other thing, is the story and then the graphic did highlight the certified SANEs. If we look at on the national level, and I went ahead and pulled up my statistics, let me get to over here to I have a Word document. We have nationally and really internationally, and this is the gospel according to Shalotta. I have nothing concrete to back this up. Thousands, I'm sure it is thousands of nurses that have attended the same course and are SANE trained, meeting the criteria to sit for the national certification exam. There's criteria that has to be met, And that criteria involves 300 hours of patient encounters that have to do with a sexual assault. And we've gotten a little broad. When I say we, the International Association of Forensic Nurses, which supplies that national certification exam, they've tried to make that as broad as they can so that nurses have the opportunity to meet those hours. But let's look at Mississippi, for example, very rural, the entire state. If you look at on a national level, what's considered rural, what's considered urban, most of Mississippi is rural. And our nurses in those rural communities are not seeing the patients or having the opportunity to meet those critical hours to sit for that certification exam. Those nurses that have been educated but haven't sat for or passed the certification exam are still sane, and they are still doing great work and taking that education that we provide and applying it to that patient population. So even though we have a very small number of certified nurses within Mississippi, we have around 1,000, a little over 1,000 that are SANE educated. So I don't want our audience here to come away thinking that we just only have 6 nurses that have attended the classes in the state. We've had a great number of nurses that have attended, but have not been able to sit for the certification exam. And then the final thing that I wanted to highlight real quick was something that I feel like is important for everybody involved in that patient encounter is to educate that patient about other resources. And listening to Julie and without knowing all the details, but just what I did hear from her and her experience and what was physically happened to her body. And I cannot imagine the long-term health ramifications that she had and may be still dealing with. We want our partners, our nurses, our advocates to educate our patients about their state victims' compensation. That is there to serve victims of crime. I work very closely with the Mississippi Attorney General's office, and we have a reimbursement that goes back to the hospital for that medical forensic exam. But if Julie had been our patient in Mississippi, even though there's a cap on the medical forensic exam reimbursement of $1,000 to that hospital, which is a great amount, that's a whole nother story there for you, Drew, on what states reimburse, but that's a greater amount for Mississippi. However, with Julie having such a very complicated case and x-rays and surgeries and possibly all of that, there's a whole nother fund that we as medical providers and our advocates can educate our patients on to say, hey, we have victims compensation to help you with this. And our state, if they have the name of the perpetrator, or we can find the name of the perpetrator, then we or the state will let law enforcement know, hey, look, if this guy's convicted and there are fees, criminal fines assessed, that needs to go back into the state to pay for the care that Julie needs and that these victims need.
Go ahead, Julie.
Oh yeah, I think that crime victim reparations point is so important, and wanted to give a shout out to Star, because the advocate who showed up at the hospital, I ended up keeping in touch with, and eventually was able to file a crime victim reparations application and get a lot of the out-of-pocket medical costs covered. It takes a long time because it is a reimbursement program. So we do think, you know, in the advocacy world that I live in now, we're fighting always for higher levels of emergency money that people can get so that they don't have to spend that money before they get reimbursed. But that's one of the reasons I got involved in Rose's project. Rose Preston, I think, is on here, the Crime Survivors Guide. because that's like our biggest thing, is telling people about CVR, which
Yeah.
covers medical and funeral costs and other things for people who've experienced violent crime. So it's a huge resource, but we're still regularly finding people who have not heard about it. We very commonly come across people who don't know about it.
Yeah, and I wanted to
Exactly.
add
Oh, I'm
one.
sorry. Go ahead, Morgan.
I wanted to add one really important caveat that I think that Louisiana has to be so proud of, is that we no longer require a report to law enforcement for any of the other types of crimes. Like we used to always, once we had something for the sexual assault component, you didn't have to report to law enforcement for that reimbursement. But for the other things you did, we no longer require that. We do have, like, you have to get like some sort of documentation, but I think that that has been a way to empower survivors to get the treatment care that they need at an expense. And then once we know their needs are met, the basic needs are met, then they can consider reporting to law enforcement. I think that that has been a really, significant thing for our state. And I do want to give a shout out specifically to Katie Hunter Lowry, who really was one of our, she really led the charge on that bill a few years ago. And she, we very much, her and Crime Survivors NOLA, like, we're all part of that in order to, get those changes into our state law. So I think it is one of the times, like, we always kind of say Louisiana and Mississippi go neck and neck on being, at the top of the worst list. But some of the things that we've done to pass policy reforms when it comes to crime survivors, in particular sexual assault, I think we really have a lot to be proud of.
Thank you, guys. I think maybe, Nellie, do I maybe have time for one more question? Because I had a kind of follow up.
Yeah, definitely. Please.
Okay, great. Yeah, Shalotta, really appreciate you expanding on that. And one of the things you mentioned at the training was you called forensic nursing one of the best kept secrets in nursing. And you had this moment where you asked all the nurses who were there for the training who had heard of it, and none of them had raised their hand. I'm sure you asked that at every training. But this question is for all three of you guys, because I think you have a different perspective to bring to this. I'm curious about what policy changes, whether that's at, for Shalotta, maybe like medical school or hospital setting, but whether that's local or state. Morgan, you're on the Louisiana Sexual Assault Oversight Commission. Is there, and you mentioned advocating actively for legislation and some of it for policy changes, some of it you're very proud of. I'm curious if there are some that stand out to you that more immediately or could be addressed to help make outcomes and experience for survivors better and more improved.
Yeah, and I know Senator Mizell was on the call. I think she had stepped out. She had passed, gosh, all of my times get mixed up at this point. But it was in 2023, or was it last year? I can't even, no, 2024. We passed the Sexual Assault Survivor Bill of Rights. We have made it, we want survivors to really be in control of everything about what happens to them after a sexual assault, what happens to their records, what happens to their body, what happens to whether or not they are forced to engage in the criminal legal process. Because what we do know is that that is not a trauma-informed, system. So if a survivor's mental health and outcomes are worse off if they go through that process, we don't believe that they should ever be forced into that process. So we've passed legislation that prohibits or limits the arrest of survivors for material witness warrants. We have required now that survivors have access to their forensic medical reports, not only have access because they were being kept from them under the guise of, well, you may be traumatized if you see what's on this form, even though it had already happened to them. They are entitled to a free copy of those reports, as well as the police reports. They have a right to be informed about having access to an advocate. And then also significantly in 2022, we passed legislation that requires, after a negative pregnancy test, for survivors to be given emergency contraception at the hospital, and it does not include any kind of prohibition or exemption if there's like a objection to that based on religion, because hospitals can't have, religious convictions. People can, and obviously a person doesn't have to engage in that. But I think that even in certain other states that have such laws, they typically have some sort of exemption to where a hospital doesn't have to provide it. And I think that in an area where we do have religious-based hospital systems, that was pretty amazing for us to not only get it passed, unanimously passed in both our House and Senate. So, I mean, I think we've worked with everyone who has, made a commitment to supporting survivors. And there's still a lot to do, like significantly still a lot to do. I think that one of the biggest challenges facing Louisiana, as we are continuing to see a little bit more in terms of funding for sexual assault nurse examiners to be able to provide these kits, we need more funding that goes into training and to pay for the nurses to go through training. I know that our Attorney General did apply for the same grant from the Office on Violence Against Women, so that way there can be, because to go to the point that Shalotta made about like the rural areas, you have to do buddy calls. So if there's never a lot happening, the grant that they proposed was to pay for the nurses to completely come to high areas where there's like at least one kit a day done for like 2 weeks to start that process, get those hours quickly, but to also pay them an hourly, to come plus their lodging. And so all of that's needed, but also advocates are extremely important and they have a separate role. Just because you have a SANE doesn't mean you don't have a need for an advocate, and we have no state allocated funding for sexual assault centers. And there was a bill passed. It's not going to generate the amount of funding that everyone, I think, believes it will generate because it requires convictions. But we need to fund services because after something happens, you need that advocate to not only accompany the survivor, you need them to help find the resources to file the crime victims reparations, full thing, to do follow-up testing. They need accompaniment for other things. I mean, sometimes survivors just have trouble getting up out of the bed and they need somebody to kind of basically be a coach in that moment after an assault to just help them do things that we get up and do every day. And so I definitely hope that we understand, not, yes, there's the DV programs. DV programs need money too. We're not trying to compete. Every crime victim matters and we need to fund all of it. So anyway, again, I could talk forever about this.
Thank you so much, Morgan, and thank you to all of our panelists. With the 10 minutes we have left, I'd like to put to our audience, if there are any questions you would like to ask, please drop them in the chat. But while we wait for that, I have a question for our panelists. So reporting really helps tell this story. Can anyone speak to what it was like, for the process of speaking to a reporter, speaking to Drew, and how that affects your work, how investigative reporting can help what you do?
I think it highlights the issue, but it also highlights the positives, if that makes any sense. Having I'm a follower of NPR and following of this type of media. I didn't realize how many other people are also followers, and so having people reach out to me through what y'all are saying about this, and having people reach out to our coalition, that's who I work for, is the Mississippi Coalition Against Sexual Assault. I was very pleasantly surprised at the follow-up and the people that reached out to us. So I think that's positive. I think and I'm just going to talk about the elephant in the room. I think the press gets a bad rap at times. And now with social media, everyone's an influencer and everybody is a news reporter. So to have a credible resource that is doing their research. Drew coming to the class, I will tell you, he's the only, I think I've had one other reporter that showed up for like an hour or so. Usually reporters will show up with cameras, film a segment, and then leave. But for Drew to come in and really get invested in the education and speak to the students. I can talk all day long. This is what I do for a living. But for him to engage with those attendees and listen to what their obstacles were to get to that point and what they plan to do and are doing with this education, I think that that had a lot more value than just listening to me. It was great for him to talk to the nurses that are quote unquote boots on the ground. And I really appreciated that he took that and went that way with it. And Nellie, you also being invested in this as well. So I think that if we could have more media that will listen, again, not just to the instructors, but listen to the Julies and the Morgans, but the nurses that are out there really doing this work, the nurse leaders that are looking for that funding, that are reaching out and going, Morgan, where's the funding and how can we partner? I think that those are the ones that we really need to highlight a little bit more. But thank y'all absolutely for this work and for bringing attention to this.
Mhm. If I could say one thing, and then I actually gave a warning at the beginning that I'm actually on call because we are so short-staffed right now, so I have to go to a call out. But for me, I had mentioned that justice comes in many forms for survivors, and I think that when justice is silent, journalism speaks. And investigative reporting is something that gives voice to survivors and really uncovers truths about institutions, about system failures. And I think when all else fails, investigative journalism has been the reason we have been able to achieve so many positive changes for survivors. So I think if we don't have more trauma-informed journalists who are willing to explore into this area that is very uncomfortable, then we will never see change. So I really want to give Drew kudos and to really, give you the I guess kudos, like I said, that you need for having come into this field. But I have to go early, so I am so sorry because now I have to go to a call out. So I am sorry for leaving early. Thank you.
Well, thank you, Morgan, for coming, and good luck, and really appreciate everything that you do.
All right, talk to you later. Bye.
Yeah, I wanted to also make a comment because full disclosure, you said I live in New Orleans. I actually now live on the North Shore in a rural area because I moved after the thing that happened. But Drew came out there and, made me really comfortable and made me feel like I was in a safe place to talk about things. And as somebody who had a pretty newsworthy case, I have had some really terrible media experiences with how that was covered in the local news, and was very wary of reporters in general. And I've been kind of dipping my toe into like interacting more with them. And this was just such a great experience. And I think it is really important to have reporters who understand, if you're a survivor and you've had some bad experiences, like we want to see what you're going to write. We want to be able to have some input. We want to have some kind of control in that process because we felt like maybe sometimes that was just the opposite of what we got from the media. So I really thought that process went very well for this piece, and I was really excited to be a part of it. And I think he did a great job.
Thank you, Julie. And just to kind of like, I really appreciate that. Very kind. Nellie, that question kind of set me, I feel a little embarrassed or shy, but I do appreciate it. And just to, Julie and I went back and forth constantly up until publication. I shared with her drafts. I shared with her the sections of that involved her narrative. I shared the radio script with her. I included her completely in that process, which there were moments where I don't think we ever really butted heads, but we were trying to like confirm some things, and I think that was really something that worked really, really well here was that, anytime I had a question about anything, or anytime Julie, you had a question about anything, we just hopped on a call and a text message, and we just kind of kept those lines of communication open. So there's never really any mystery, or like, I felt like this wasn't necessarily my story, right? So I didn't have control over this. And so I was really just grateful for Julie contributing her perspective and her experience to this project. But, if at any moment you wanted to back out, then that's what would have happened. Yeah, I think that was just something I wanted to maybe keep in mind, and just talk about, just a little bit of my perspective on as we went through that process. It was also very pleasant. It was really nice. It was really great to meet you and talk with you and visit with you and talk with you over the couple of weeks. So yeah, so I'm just adding my little 2 cents to it.
Thanks so much, Drew. We're really grateful to our guests for their courage and candor sharing with us today. Thank you also to Type for making this investigation possible. Drew worked on the story for a year, so there's a long story. There's also audio journalism and reels produced as well that will get sent out to everyone who attended today. If there are any other final statements or questions from our panelists or our audience, feel free, please. All right. I think we are going to go up, Drew.
I was just going to say thank you to everybody for coming, and we'll have all of our contact info when we send out everything. Please do reach out. Happy to talk more about this, talk more about other things. Anything interested, please do feel free to reach out anytime.
Yeah, thank you so much for joining the Gulf States Newsroom for SANES and Survivors in the South. We'll see you next time.